Welcome. I'd like for you to turn to your neighbor and tell them that you are glad that they are healthy enough to be here in the building with us today. If you would do that, that would be great. That alone is worth being here. That's what community is all about. I'm your service leader. My name is Nancy Hagman, and I will be leading the service today. My pronouns are she and her. If you would turn off those devices that tend to ring when you are the most likely to be embarrassed, if you would do something about that, it would be great. If you're visiting for the first time, we're really glad you're here. If you're visiting for the second time, we're sort of glad you're here. But if you're visiting for the third time, that's magical. So welcome, and welcome to the people that are online. I always forget that don't do anything too wild, because it's probably recorded. And I've been asked before about pictures that have been posted online. I had no idea what I was doing at the time, and I know it looked wild. So just be careful. It's all online today, so thank you. We are a lay-led congregation. We have a pamphlet available if you'd like to know more about us. The best way to know about us is to talk to somebody that's here. Just say, please tell me about this church. Let me know what you do here. Why do you come? And why do you return? What makes this special for you? I'm going to introduce our ministry team minute so that a lot of times people come to the congregation and they may even join the congregation, but they're not real sure how to get involved. And we have about 4 or 5 teams, and a couple weeks ago you got to see some pictures that Mary Beth, in charge of Fun and Fellowship, posted showing you that we actually do things besides Sunday morning. And it was fun, and she will come back and tell you about that ministry team and how you can be a part of that besides just attending. And the other ministry teams will be posted throughout the year so that you can find out where your niche is. We enjoy your niche. So whatever is your genius zone, please join us. And I'm going to tell you a little bit about Sunday services. These services happen by magic. And it only happens by magic by multiple people. So there are 6, 8, or 10 of us that gather about 5 times a year to talk on Zoom to decide what kinds of services we want for the year. I happen to lead that particular structure, and I'm not comfortable if I don't have 3 months out scheduled. So sometimes that's frustrating to other people, but it's very calming to me. We get ideas from the community. We ask that you, as a community member, pay attention to people in your community that you circles outside of here, that you come to us and let us know the kinds of things you want to hear, the kinds of speakers that you've seen that did well, that you think our congregation would enjoy hearing. It falls in the realm of the web of community, and if they fall within our 7 or 8 principles, we want them here because we want to stretch who we are in all of our ways of thinking and emotionally. We have service leaders. It was a good job for me to do today. I haven't done it for several months. a good reminder of how much goes on behind the scenes. We'll use this music, no, we'll use that music. How about this music? How about posting that word? How about posting this word? So consequently, the service leaders, if you've been a service leader, please raise your hand. If you've been a speaker here, please raise your hand. If you've shared ideas about speakers, please raise your hand. That's how many people create Sunday services. So, and then behind the scenes are the musicians. How many people have joined the musicians before? How many people have joined the choir before? Now, if everybody would raise their hand and see where all the people are that make this happen, please. And what else we have are caregivers for our kids. So thank you very much. Now you know about the ministry team. And we will, I have to say this. One time somebody came up from the community and they said, how about this? Can we do a service on this? And I thought, oh, that's a great idea. I said, would you like to do the service? That doesn't always happen. Sometimes we look for a speaker. And I said, would you like to do the service? And this person said, I can do that. And we had the magic of Mike Swaney, as you've all heard before, speak to us about UU's history. And he will be back in July for his promised second service. So bring your magic here. Bring what you have. How would we know that he had the depth of knowledge nor the ability to speak about it? There are two parts to this. And now we will have centering music from our musicians, please. All right. Oh, no, we aren't. Happy birthday first. I'm sorry. No, I'm sorry. I have to back up. Somebody said, do you write everything down? I said, no. I haven't finished the announcements yet. I skipped them, and somebody's going to tell me about this, so let's do this. The Price is Right. This is from our fundraising and finance committee. You'll hear from them again. August the 3rd and the 10th, in the conference room, there are no set prices. There will be things to purchase there, and you come and pay what you can. Select what you like, take your treasures home with you. Payment methods can include time, talent, or treasure. It's a wonderful opportunity to give back to the church while finding something special. All proceeds will go to support our church and its initiatives. If you wish to donate items for the sale, you can contact Mary Beth Ramsey or Christy Ging. Space is limited. Our conference room is only so big. So reach out to them soon with your contributions, and thank you for your support, and look forward to seeing you. This has been a great fundraiser in the past, and we would love to do it again. There's another announcement. Penny Featherstone's home is going to be open for a communal bake date. This is this Saturday, 5th of July, so you can celebrate the 4th of July on the 5th of July at 10 o'clock. And Athena Letsu, a trained baker, will guide us through a recipe of Mexican pan de luz as a celebration of resistance. During the Mexican Revolution, revolutionaries not only fought, but they also cooked, organized, and kept the community fed during the time of extreme chaos. Pan de luz, also known as sweetbread, became a staple during this time and was even used to distribute messages in secret amongst the revolutionaries. So join us in an effort to build sacred community and honor the spirit of resilience. If you're interested, please see Penny or Athena, and you can find their numbers in Simple Church. And Penny is here in the service, and Athena hides in the sound room and does an excellent job. And I left her out on about Sunday services. She's here every week, and we do have a substitute once in a while with Ian Briggs. Sunday service and CRE team have an announcement to share about our children's program. The religious educators recommend that our children attend regular UU services once a month for the entire service. This practice helps to enable our growing children to understand and become part of the congregational life of the church. Beginning in July, on the first Sunday of each month, children are invited and encouraged to attend the full service with their caregivers. There will be child care available for infants and toddlers only on the first Sunday, as there is each week. The children's RE program will continue all the rest of the month, which means that the adults that are here on the first Sunday increase your level of patience before you come into the building. And now we're going to have centering music, right?
Wait, there's one more.
What did I do?
Vallarta. If you want to go to Vallarta,
Oh!
just see me
See, I knew.
after service.
This is today. We can all join. And again, this is a spontaneous, decide what you want to do. She's announced it for weeks, but today's the day. So Vallarta, I have it last right here. Yeah, it is last. 11:45, we'll meet over there. However, Mary Beth needs to know you're coming so that she can ask them for the right amount of table space for us. And now, I guess I need to be centered, please.
All right, so I think let's sing an Om together. So an Om is inhaling and exhaling slowly and putting a sound on your breath. So we're going to do an Om together. So it's just putting a sound on your breath. Everybody's Om is going to have a different length. And we'll just sort of do waves, like a sea of Oms. Om is this, the sound of the universe being born. Gorgeous. Barbershop 110. Gorgeous, yeah. Gorgeous.
Each week we light our chalice. It is a routine for us because it allows us to begin our community in sacred space. And I will read a few words. Why community? To remember that it is not a whole number. What we need, both our roots and our wings. That strength comes from relationship and mutuality, that we know life in and through one another. On our opening words. Community is the spirit, the guiding light of the tribe, whereby people come together in order to fulfill a very specific purpose, to help others fulfill their purpose, and to take care of one another. And today ends LGBTQ month called Gay Pride. Excuse me, and I'm reminded that it is only raising an awareness. The month is only here for raised awareness. And as we close down this month, I encourage you to remember that LGBTQ people are LGBTQ people all year long. It doesn't stop with June. Thank you. Today we're going to do something special for our community. Somebody couldn't be here today, but they are very special to our community. And in a minute, I'm going to ask you to do something that we have probably never done before. However, that doesn't mean it isn't going to happen again, but today it is going to happen. We have a member of our church, and it took a long time to pull her name well, Flo Fulweiler, and she was 103 years old this last Wednesday. And we would like, as usually, we light a candle, but we do not record that section. So we would like to sing happy birthday to her in unison, or not in unison, but have it be on camera, we need everybody to stand up and turn around, because our cameras that work really well with this are in the back. And if you are on the back wall, you'll have to come forward, because I don't know if it'll catch you or not. Make sure you're in the camera. Jack, you're not in the camera. I'm calling you out. She needs all of us. But what's very special about this is her family knows about this recording also. And it's really, really significant that our community, she started many years ago and has been part of this community over 50 years. And so there's an honoring that is above and beyond a birthday song. So if somebody would lead us in happy birthday. Happy birthday to you. Happy birthday, dear Flo. Happy birthday to you. Yeah, raise your hands. Wave to her. This is your community. Thank you. And there are a couple of pictures of Flo. One of them was taken on her 90th birthday, and you'll recognize someone else from our congregation in that picture. This is Hannah Laurie, and the next picture. And I think there's another, is there another picture? No. There isn't another picture. Oh, well, you can go see her, or you can send her cards. Okay, thank you. Our opening hymn is One More Step in your gray hymnal, 168. If you'll please stand, and we'll sing together, and the choir will come up.
One more
you'll remain standing, we'll say our covenant together. Love is the spirit of this church, and service its law. This is our covenant, to dwell together in peace, to seek the truth in love, and to help one another. Thank you. You may be seated. Now is the time in our service that we share our joys and sorrows as a community. We do not record this time. We share it with those that are here and present today. The first candle will be lit for those things that are in our hearts, but beyond perhaps our ability to touch today in our world. And we will close with the candle at the end of those things that are touching our hearts and unspoken. And Penny's going to come help with the microphone. When it was time to think about time for all ages, I couldn't help but think about my children. Excuse me, they are in their 40s and close to 50 now, but they were once my children in the time that was bedtime or reading time or whatever that was. And they had a couple favorite things. And so our time for all ages is with Shel Silverstein. And if you'll hang on just a minute with the slide. If you've ever seen Shel Silverstein's work, by all means, take time to sit down and laugh. If you haven't seen his work, by all means, sit down and laugh. And so today, I'm going to read a couple. I looked them up online, and they're there. You can listen to them online, but there's nothing like the voice of a child or the voice of a parent reading to a child. So this one's called Band-Aids. I have a Band-Aid on my finger, one on my knee and one on my nose, one on my heel, and two on my shoulder, 3 on my elbow, and 9 on my toes. 2 on my wrist, 1 on my ankle, 1 on my chin, and 1 on my thigh. 4 on my belly, 5 on my bottom, 1 on my forehead, and 1 on my eye. 1 on my neck, and in case I might need them, I have a box full of 35 more. But I do think it's sort of a pity I don't have a cut or a sore. And the other one that was always a favorite of ours, it's called The Crocodile's Toothache. The crocodile went to the dentist, sat down in the chair, and the dentist said, "Now tell me, sir, why does it hurt and where?" And the crocodile said, "I'll tell you the truth. I have a terrible ache in my tooth." And he opened his jaws so wide, that the dentist, he climbed right inside. And the dentist laughed. "Oh, isn't this fun?" And he pulled the teeth out one by one. And the crocodile cried, "You're hurting me so. Please put down your pliers and let me go." But the dentist just laughed with a ho, ho, ho. And he said, "I still have 12 to go." Oops, that's the wrong one. I confess. But what's one crocodile tooth, more or less? Then suddenly the jaws went snap, and the dentist was gone right off the map. And where he went, one can only guess, to north or south or east or west. He left no forwarding address, but what's one dentist, more or less? And now we'll sing the children out. And now it's a time for our special offering. We try to reserve the 5th Sunday of whatever month the 5th Sunday falls in for our Pass the Plate offering, which means that the plate or the baskets that are passed, all of that money goes to the organization, a nonprofit. Again, it's taking our community and stretching into the larger community and supporting a nonprofit organization. So as we pass the basket this time, know that you're giving to community Northwest Florida. And also, if you need to contact the church or give of your own money for supporting the church, you can do that by the information that's on the screen. And if you would like to join along, you may sit while we have in your teal hymnal, 1009 is a type of meditation that we are going to share together. And the choir will come and lead us. I'm pleased to introduce to you a member of the community at large. And once again, I remind you, it was Marcy Moreland that came and said, I think this would be a good speaker for our community. So from our internal community, we draw and offer support to our external community. And so I get to introduce Walter Arrington. I had his name totally spelled wrong until, again, I had someone who edits things well, Joe Vincent. Nancy, I think you got the name wrong. And I said, I love editors. Oh, really? He's a social worker here in town. His pronouns are he and him. He has provided advocacy for community health. He's a native of Northwest Florida. He was a veteran in the Marine Corps. He is a veteran in the Marine Corps, and formerly he was an unhoused person. He has also worked for justice and been involved in social justice. I welcome Walter Arrington.
Thank y'all for having me here today. This is the first time I've been into a Unitarian Universalist community, and there's such peace here. I was raised a preacher's kid, by a queer father who was a music minister, and I always joke, I say, you know, you don't have good music unless you've got queer people in the congregation, so, you know. But I wanted to open today first with a quote that is, it's actually hanging in my office at work. It's a Panhandle Slim piece, and it's a quote by James Baldwin, and it says, "The world is held together, really it is held together by the love and passion of very few people." And I'm a quote person. That's kind of, when I'm having a rough day, I look at these words of people that some have come before me, some are still with us, and they inspire me. And it's a quote that I think really hits home. I work for Community Health Northwest Florida. You ask, what is Community Health? So Community Health Northwest Florida is what's called a federally qualified healthcare center. And what that basically, what that's rooted in is in the 1960s in Mississippi, you had healthcare providers that looked around and they said, people experiencing poverty, people in rural backgrounds do not have equitable access to healthcare. And so some doctors got together, some social workers, some healthcare providers, and they started what amounted to basically free clinics. They got some governmental support, and the movement has grown. And so there's a little over 1,700 FQHCs across the nation. There's generally not a community in this nation that does not in some way have coverage by FQHCs. And what makes federally qualified healthcare centers different is that we fundamentally believe that healthcare is a human right. We provide care for all people, regardless of ability to pay or insurance status. And so it's a little bit different than a normal doctor's office where, you know, if you come in and you say, hey, I have no income, I can't afford to pay, what we do is we base what you pay off of what you make. So it's equitable access to health care. If you're unhoused, we provide that care at no cost to include your pharmacy medication, which is a big thing. And we have various other programs. So for me, a little bit about my background and why I got involved in community health. I was one of those people who had a rough road after I got out of the military. And what resulted for me was 4.5 years of homelessness and just trying to figure things out. I was lucky enough to have a social worker, and one of the reasons why I became a social worker, that treated me with love and respect and saw me for who I really was and not my circumstances. And that radically changed my perspective and my trajectory in life. Fast forward a few years, I was at school at UWF, go Argos. And I had gotten involved with the homelessness task force, and unbeknownst to me, you know, Connie Bookman had came up to me and she said, hey, I need you to tour around these people to some of the service providers in the community. And I was interning with the Washburn Center with Mike Kimbrell, and I had utilized services with a lot of the service providers in the community. So I took these people around, and come to find out, one of those people was Chandra Smiley, our CEO at Community Health, and then Jules Carrier, who's the Chief Advocacy Officer for Ascension, Florida. And they created a role. And so they saw the need within the community for our unhoused community and our impoverished community that needed somebody that understood their unique needs and had those relationships. And so I got to finish up school. I got to get an employment-based internship, which is a real big deal for social workers. Unfortunately, we still have a history of exploiting internships, but we won't go on that. But long story short, I got to do a lot of really cool things. And community health is public health, and it is a service to the community. And I always say, I'm in public health because I love the community that I live in, and it's not, because I want to go open a private practice and make a bunch of money. Although it's nice, we're here to serve. And so, at Community Health, I've gotten the opportunity to work and develop our unhoused health navigation program, and we developed a core program which provides substance use care to individuals in our community, and that's just really different. My experience in life when I would go into a medical facility, sometimes I felt like I was just a number. Working at Community Health, and I'll be the first one to say it's not always like that. We absolutely make mistakes, but we try to be there for the individual, for the community, for the person. One of the other things I love is that we are federally mandated through actual legislation to be the healthcare providers for our immigrant community, regardless of status. We probably have the largest empanelment of individuals who are coming to this country to seek a better life. And because we're federal, we get to dodge. I shouldn't say dodge. Let me back that up a little bit. Our rules and policy are different because we are not beholden to some of the state reporting. So we get to protect the privacy of our patients. And so we get to do all these great things. Now at Community Health, I do advocacy and special projects. The special projects meaning I do all of our grant writing. So give you a big overview of what we do. So we've got roughly 52,000 patients that we serve at Community Health Northwest Florida. We've got 16 static clinic locations across Escambia and Santa Rosa County. We have 3 mobile units, 1 medical mobile unit and 2 mobile dental units. And of those 52,000 patients, roughly 80% are 200% or below the poverty line. Roughly 40% are uninsured. We only get roughly about 11% of our budget from grant funding. That's one of the big misnomers I think people have. So how do we survive? Well, we do a lot with less. And that goes back to the quote with James Baldwin. I truly believe that people who I work with and people who I call colleagues, we work in public health because we have a passion and we see the impact. So with that payer mix, basically, we rely on our insured patients. So I always say, if you're looking for a healthcare provider and you want to stick it to the insurance company, not that we love you insurance companies, come see us, because when I go in and my primary care is at Community Health, my pharmacy's there. My insurance reimbursement pays for the services for somebody who may be uninsured. It offsets those costs. We call it payer spread. We always looking at the numbers, how many visits versus uncovered. One of the other cool things is we have our 340B program, and I was talking to Nancy about this, and she thought it was really cool. So, not to get too technical, but 340B is a federal program to where federally qualified healthcare centers we're able to purchase medications below market rate. We have contracted rates with the pharmacy companies, and then we're able to turn around and bill insurance companies at the market rate. And so if I get a medication for $5, I bill insurance for $10, we get to keep that $5, that spread, and that's what offsets the cost of care. So if you're not using community health pharmacies and you just want to do something that helps, we have 4 pharmacies across Escambia and Santa Rosa County, and we deliver. So We will deliver your medications to your home, collect your copays. And so you say, well, how can I share with my community and help support my community? Get your prescriptions filled with us. You don't have to see us for care. Just fill your prescriptions, because every time you fill, it helps support another member of our community. One of the things that I was really proud of, and it's been a piece of heartache for me over the last few years, has been our LGBTQIA healthcare clinic. We did a lot of great things on that, and fortunately, due to administrative changes and policy changes, we've had to roll back a lot of that. I always say we're primed and ready. When things change, we'll be back. But again, for me, it's working in healthcare that truly tries to meet the needs of the community. We've got a bunch of programs. I'd be happy to talk after service. I've got some of my cards sitting out there. You know, I always encourage you to call me if you have any questions on, you know, what do I do? I've got a really thick Rolodex. I really appreciate y'all inviting me today and letting me share some of what community health does. Because we just, you know, if we don't have each other, what do we have? You know, viewing healthcare as a fundamental human right and not as a center of profit, I think for me personally, is a shift that we have to make as a community, as a nation. Nobody should have to struggle with, am I gonna pay rent or am I gonna pick up my medication? Nobody should have to struggle with, oh, I have to wait till this problem gets worse so I can go to the emergency room. A lot of things are changing right now in this nation. We've got legislative changes, rollbacks, but community health is here to stay. Things may look different, but I always say, as I've grown within the company, we're really good at playing with the edges, and finding the loopholes. I feel like that's very much a social worker ethos, is that we find the loopholes and then we exploit them for everything that they're worth, within the bounds of ethics and laws. But we're good at that. It's find the entry point and put that patient first. So anyway, thank you so much for having me.
You're welcome.
Thank you, Walter. We are going to sing our last song together, and the congregation has some really difficult words that are repeated repeatedly. And so I'm going to show those words to you first while the choir comes up. There they are. Bread and medicine. And you're welcome to sit or stand, but it is a chant. The verses will be shown so that you can get the words. Sometimes we sing so fast it's hard to get the words. But the words aren't for you necessarily to sing. Your words are what? Got it. Enjoy. This is a Rivka and Mike original with Ray.
Bread and medicine, 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 bread and medicine. We don't need another billionaire. We don't even need a millionaire. We don't. We all know it. Here's what we need. Bread and race of have-nots. It's a fact, simple. Don't make me plead. Bread and medicine, 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 bread and medicine. Everybody wants a 4-foot, 6-foot, 7-foot television screen. Meanwhile, some people can't eat, can hardly sleep enough to catch a dream. Might have to scream. Bread and medicine, 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 bread and medicine. Here in these late stages of power over power over power over power, cower, lower, rape and plunder underfoot, gold plate, space suit. This is not a system, it's a symptom of disease. Bread and medicine, 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 bread and medicine. Here's what we need. Don't make me plead. Might have to scream. Bread and medicine.
Together, we have truce. Together, we have a story. Together, we are a community. Go in peace. Blessed be.